Well, hello and welcome everyone to our webinar, Certified for Success, the role of board certification in pharmacy. My name is Danielle Kirkland and I will be your moderator for today's session. So we have a great panel lined up for you all. Before we get started, the session is being recorded and we'll put the recording on the Pharmacy is Right for Me YouTube afterwards, in case you want to rewatch any of these parts. Throughout, feel free to put any questions you have for our panelists in the chat. We are going to start with some pre-submitted questions, but we're more than happy to take live questions throughout. So again, feel free to put them in the chat as we go. But with that, I'm going to hand it over to Kate McKenna to give us a brief introduction into the Board of Pharmacy Specialties.
Thanks so much, Danielle. Hello and good evening, everyone. Welcome to today's webinar. My name is Kate McKenna, and I'm the Manager of Communications and Engagement with the Board of Pharmacy Specialties. Since we were established in 1976, BPS has served the profession as the gold standard in pharmacist certification. With 16 certification programs, BPS offers pharmacists a way to go above and beyond their licensure to demonstrate not only specialized knowledge, but a commitment to ongoing professional development. Really excited for all of you to hear from 4 BPS ambassadors today who hold board certification in ambulatory care pharmacy, pharmacotherapy, and compounded sterile preparations pharmacy. They will share their why behind pharmacy and the role board certification has played in their career. After this webinar, I deeply encourage all of you to consider your own career plans, and if board certification is something that's interesting to you, you can learn more about us at bpsweb.org. Thank you so much for tuning in today, and I will hand it back over to Danielle.
Awesome. Thank you so much. And so with that, I will have the panelists introduce themselves and tell us a little bit more about what their role is now and how they got to where they are today. So with that, I'll hand it over to Danielle to kick us off.
Thank you, Danielle. I am also Danielle Zsido. I went to Albany College of Pharmacy and Health Sciences in upstate New York, and I did ROTC in pharmacy school. So that's why I'm wearing fatigues today. I graduated and commissioned into the Army as soon as I completed pharmacy school and have been serving as an Army pharmacist for 12 years now, which is hard to believe. And I've worked in military hospitals and clinics and headquarters all around the country and all around the globe. For the past 12 years, I became board certified in sterile compounding about halfway through my career. And now I'm at the Defense Health Headquarters in Falls Church, Virginia, serving as the Deputy Pharmacy Consultant to the U.S. Army Surgeon General. And I'm really happy to be here today talking to y'all.
Great. And then I'm Jennifer Wick. I am the current Assistant Director of Pharmacy at the Christ Hospital Health Network for Ambulatory Services. So I manage our outpatient space and operations there. But I originally went to the University of Kentucky for pharmacy school before going on to do residency first at West Virginia University with Kroger, and then going on for a second year at Palm Beach Atlantic University with a primary practice site at the West Palm Beach VA. So when I first got started, I was one of our first pharmacists hired into the physician division and really starting ambulatory services. And so got board certified there to kind of further not only my own career, but also discussions with providers and expanding services as we got implemented into the clinic sites there. Excited to be with you all and answer some of your questions.
Hi, Al. I'm Angie Wowczuk. I graduated from West Virginia University, and I worked in community pharmacy for several years before coming back to WVU to work for an organization called Rational Drug Therapy Program as a staff pharmacist. And we do the prior authorization reviews for the West Virginia Medicaid program, the Public Employees Insurance Agency program, the Children's Health Insurance program. And we also have some grant work that we do along with the CDC in the opioid space. We've done some academic detailing programs in the past as well in the ADHD space. And I got my BCPS several years ago as I transitioned into the director role for Rational Drug, and I'm now the administrative director for Rational Drug, as well as a service assistant professor for WVU.
I think I'm next. Is that correct, Kate?
Yes.
Yeah.
All right. Hi, everybody. My name is Dr. Rafael Sanchez, and the question, remembering again, was what inspired me to pursue pharmacy. So for me, pharmacy just brought three things that I really deeply care about, which is science, communication, and service, into a profession where I just really enjoy participating in it. And so I completed my studies, well, undergraduate studies at UNC Chapel Hill. And during that time, I really enjoyed working with underserved populations when I would do a lot of the student organizations that then eventually allowed me to pursue pharmacy at the University of Florida College of Pharmacy, where I really began to, again, appreciate everything that pharmacy could do for a patient, but also within, I believe, our own profession and expanding new avenues that I think we've already established with some of our panel members. And so after receiving my undergrad or my graduate degree from Florida, did a PGY2 in AmCare, and again, really solidified how much I liked helping people with my knowledge in pharmacy, which allowed me then to pursue board certifications. And so in the current day, my career just naturally evolved into a blend of clinical practice, teaching. And so today I'm also a faculty at the University of Texas at El Paso, a clinician and a federally qualified health center, a program director, and a program builder. So I'm excited to be here today to share some of that experience.
Awesome. Thank you all so much. So let's go ahead and jump into our questions. Again, just a reminder to all of our attendees here, feel free to put questions that you have for any of our panelists or all of our panelists in the chat. But the first question I have for you all is, what does a typical day look like in your current role? So what kind of walk us through what your day at your work looks like?
So now that I'm at a headquarters building, I'm no longer in a clinical setting. So a normal day here would look like writing DoD pharmacy policy. The Defense Health Headquarters took over all the military hospitals, whereas they were originally Army, Navy, and Air Force. They all fell under the Defense Health Agency a few years ago. So our job here is to write standardized policy that would apply to all of the military hospitals, regardless if they were historically Army, Navy, or Air Force, to just ensure that regardless of what military hospital a soldier or a sailor or an airman presents to, they're getting the same care. So I, as an Army soldier, could go down to Walter Reed, which is historically Navy, and receive the same pharmaceutical experience there that I would at a Army hospital, for example. So it's a lot of policy writing, a lot of liaising with the DEA and things like that before we write the policy, since we fall under federal law versus state law at a military facility. And yeah, basically just talking to a lot of people and trying to find common ground so that we can write a policy that works for everybody. A policy that would work on a Navy ship or an Army tent or wherever they're delivering the medical care.
And I think for me, there's some things that are every day, those are a little bit more consistent. And then there's things that kind of come up. So your day's a little bit different from day to day. So things that are usually a little bit the same is we usually have a lot of questions from our physician offices in terms of drug compliance. How do I store this? How do I get drug where it needs to go? I haven't been familiar with this product. Can you answer questions like this? So a lot of compliance issues and questions from our providers come up on a day-to-day basis. And then we also support them by physically going into the offices. And so every other year we make sure to get touch bases with our providers by physically going to where they're at. We have quite a few different sites, and they span in distance in the tri-state area. The furthest ones I think are like an hour and a half apart. So going to all of those and making sure that they feel a pharmacy presence and making sure that they feel supported in their practice by pharmacy, even if there isn't a pharmacist physically located in their clinic, because some of them do have pharmacists embedded in the offices for clinical practice underneath the ambulatory structure while others don't. I also manage our dispensing site, which is within the hospital. So we run a pretty big meds to beds program. And then we also do like transplant vaccinations. So we're maintaining all of the protocols, making sure they have access to the products that the providers need, and then also making sure that we have the technology in place to be able to facilitate those meds to beds prescriptions and get patients back home safely without that extra stop at the pharmacy. We also do a lot of clinical policy development, so writing different practice agreements so that pharmacists can manage disease states with their different providers. And then if there's anything that comes up in terms of expansion, doing budgeting for those places, looking at do we have enough office space, going through kind of strategic planning through the years. So it can be a pretty very day-to-day in terms of meetings and what's going on. Some things that are always consistent are the compliance piece, and then IT and like law and drug are always changing. And so you're always reviewing the things that you write to make sure that you're going to the next thing. So it's always staying up to date with all of the various changes that are going on.
For me, my day is different almost every day. So a big part, the bulk of my job is service-based. I have a newborn next to me, so if you hear any background noise, I'm on maternity leave. But my service-based part of my job, so I manage the staff. So managing my academic detailers includes helping them develop materials. Out of Rational Drug, we've formed panels that have created guidelines for opioid use and for treatment and evaluation of ADHD. So, coordinating the meetings and the different materials that come in, proofing everything, making sure everything goes through the correct channels for approval, creating new CEs, making sure we get approvals from the different boards to offer those to physicians, pharmacists, social workers, teachers. Those are all different boards to work with. For managing the staff in the call center. So if they have supervisor requests, I speak to physicians and pharmacists about their questions about how the call center is being handled. If there is a final say needed for a clinical review, I help out with that as well. Part of my job is also teaching based, so I get to work with rotational students, which is really fun, and I have some classroom teaching, pretty minimal, but I get to teach probably 3 contact hours a year in addition to my rotational work with students as well. So that's also part of my job. So a little bit something different every day, but I like the variety a lot in my practice setting.
So for me, a typical day, kind of like what everyone has been saying, isn't very um, similar. So every day does honestly look a little different, as we've been saying, which is part of why I like my career. I really love my career. Some days I'll be in clinic, helping patients manage their chronic diseases like diabetes, hypertension, HIV, or other consults that may show up. Um, Other things that we do, especially within the clinic setting, are insulin regimen adjustments. We use a lot of the diabetes technology like the sensors and the Omnipods. So trying to make that into more mainstream in the primary care setting. With also the new medication access barriers that we're seeing through prior authorizations, and I think some of our friends have mentioned. So also being able to address not only from a patient-to-patient level, how do we help a patient get access to a medication, but then also writing policies to implement them clinic-wide. So within our system, we have 6 clinics. And so when something works out, how do we replicate it to the other sites? Um, Other days, I'm teaching pharmacy students in the classroom at our School of Pharmacy. So developing clinical lectures, mentoring our residents, or again, helping building new patient programs within our community. Another thing that we're very happy to start within our institution is being able to partner with local community pharmacies to provide more clinical services and, again, accessible services to people that aren't always able to get into their PCPs because of underserved and really shortages of providers. A big role, I think, that my job tends to take up a lot is just really that piece of, again, helping others navigate a complex system where it just seems to be like every single day there's a new rule, a new policy that we must follow to become, again, able to get access to whatever it is that we're trying to do for the patient. So I think every day is wonderful, kind of like the song from Christina Aguilera. Every day, or is it every day is beautiful? I forget, but it's wonderful, I think, because there's just different many ways to help someone, and it's cool that a pharmacist is at the forefront of these things.
Awesome. I was wondering if you could each talk a little bit more about what exactly is your board certification, and what did you have to do to earn that certification?
I'm board certified in sterile compounding. There's two different routes to get my certification, the residency route or through clinical practice, basically. Out of the past 7 years, 4 of those years have to be with experience of sterile compounding. And then your employer writes a letter to BPS that attests that the last 4 of 7 years have that experience. So I went that route, the experience route. Does that answer the question? Was that the full question?
Yes, thank you.
Okay, awesome.
So I think you'll find that that's pretty common amongst a lot of the board certifications. So I'm board certified in ambulatory care, and similarly, they have like a practice route or the residency route. I qualified through the residency route because I had done my second year of residency through ambulatory care. So essentially, what that involved is you like go in and you take an examination, and it covers a broad variety of disease states that you might see in an ambulatory care clinic. So at the time, I was practicing in a primary care clinic. I had just gotten out of residency, but then also obviously putting a lot of significant time in studying and getting resources online, talking to other people about their experience with the exam, and then finally testing and passing. And then ongoing, there's continuing education requirements to keep up with that over the years.
So I am certified in pharmacotherapy, so BCPS. I spent about 5 months studying. Studying materials came from ACCP and ASHP. I went the experience route as well, so I had my employer attest to my experience being relevant to that exam. And I felt like 5 months was a good kind of time length to spend studying because it is a hard test. I mean, it's definitely not something you would take on a whim. And it's also something that you want your practice setting to prepare you for. I don't know that I could have gone just off of testing materials and had not really good clinical background in my job. So I thought that was really helpful to me as well. But if you do take it seriously and study and have the good background, it's very, very doable to take the test. And I thought it was really beneficial for my experience in my career. And once you get that, like Jen was saying, the CEs are really great and they help you keep up on current clinical topics. So that was my path.
So my certification is in ambulatory care pharmacy as well, and I acquired it through the residency route, similarly to I think Dr. Wick did. And the one thing that I'll add, just to, because I think we all said it kind of differently, but with a similar message, the key thing I think is just being involved in the practice, and I think the test in a way takes care of itself. Like yes, you will have to practice and study and all this other things, but it's really the clinical experience that you have that really should make the exam not too, again, highly demanding. So it's something that you should be doing already within your job. And it's now just having that validation to say, yes, this person does, meet all of these qualifications to do these things at a higher level.
Awesome. And we're starting to get some audience questions, so I'm going to jump to those. The first one, maybe Danielle or Kate could answer this one. So this one is there a special military program or route now for military personnel?
There are pharmacists in all branches of the military, Army, Navy, and Air Force. And it's separate from board certification, but there's, at least for the Army, two different ways for pharmacists to join the Army. You can do ROTC while you're in pharmacy school, and then it kind of happens all at once. You graduate and commission into the military at the same time. Or if you're already a pharmacist, you can direct commission into the military, and then they do more of a loan repayment versus ROTC scholarship route. But yeah, those are the two ways to be a pharmacist in the military.
And to the board certification component, while not having a special military program or route, there is funding and reimbursements for veterans through the VA and through the U.S. Army Credentialing Assistance Program. So I'll drop those links into the chat, but I think it's definitely something that you can pursue, but you'll have to have some sort of understanding not only of the Army system or of Navy or whatever branch you go into, but also just confirming the certification components as well.
Awesome. Thank you. Another question here. Is certification the same as a specific field in pharmacy? If anyone wants to tackle that question.
Could you repeat the question one more time?
Yes. Is certification the same thing as a specific field in pharmacy? So I think what they're asking is, do you have to have a certification to, for example, work in ambulatory care pharmacy or something similar?
So from my perspective, I would say there are some things that are more broad and some things that are more focused. So a great example of this is like we have cardiology outpatient clinics where they see various patients. And we've got pharmacists there that are board certified in cardiology pharmacy, and then also those that are certified in ambulatory care. So it's not necessarily that like one certification is going to shoebox you into one role or another. It's really like, how does it apply to that particular population and setting? So for our case, where we are seeing cardiology patients in the ambulatory care setting, ambulatory care and cardiology are both very highly applicable there. And so that's why you see both of those certifications. However, if you're working in like sterile compounding, that's a little more specific. So obviously there is one specifically for sterile compounding. And so I think it kind of depends a little bit like what type of practice area you're looking at, how to answer that question.
Great.
For BCPS, it's really a general, it encompasses all disease states. So if you're not sure which one to go to or which practice setting, that's a good one to get to.
Great. And that actually goes along really well with the next question, which was, what was appealing about the specific certification that you got?
I always really enjoyed compounding, sterile and non-sterile compounding in pharmacy school. It was my favorite part of pharmacy school, were those labs. I just genuinely enjoy making an IV in the hood, and I enjoyed punching the little capsules and making the emulsions and potions and stuff. It's the hands-on part of pharmacy, or it felt that way to me, and that was always very appealing. And then my first job in the military, they put me in an inpatient pharmacy, and I really loved it there as well. They let the inpatient pharmacist respond to the codes in the hospital as well, which I also thought was very appealing. So I always just really genuinely enjoyed the compounding aspect of pharmacy, that hands-on aspect. So that's what drew me to that.
I think for me, the main thing is I had taken a job in an area where there weren't a lot of pharmacists in our outpatient clinics when we started. And so I was building a lot of the services, but in talking to physicians, like talking about how we could implement in different sites, the different disease states we could talk about, we could see patients in the same clinics. Being board certified in ambulatory care, it covers a really wide variety of disease states. So like you've got diabetes on there, but you might also have your heart failure patients on there. And so since I knew I was going to be stepping into kind of that service building role, having a board certification to back up that kind of overall practice aspect that covered such a wide variety of disease states was really appealing to me as we went into service planning and then eventually as I went into management as well.
I chose mine because of the broadness of it as well. I had the advantage of knowing I wanted to stay in the practice setting and in the job that I was in. So I knew I needed to be educated enough on all disease states because we did everything for the Medicaid CHIP program from stimulants to home IV. So we had to have a little bit of a broad scope, and I felt like BCPS prepped me for that really well.
For me, BCACP seemed pretty important because, in addition to what everyone has mentioned, I think the interdisciplinary collaboration is going to be very key in terms of how much business you get. And so oftentimes it's just unfortunate, and I say it like this, right? Because yes, it represents so much more than just letters, but then again, outside looking in, meaning that as a profession, we understand that there's a lot that goes behind those letters, but simply just to, again, another physician or medical director or another provider who is very skeptical about a pharmacist, stepping up into a new role, especially within this, again, non-traditional roles of beyond the dispensing that we normally have known pharmacy to be. It does help to have something that says, hey, this person's legit in the sense of they've been tested literally to show that their knowledge passes a certain threshold, which again should give your other teammates hopefully more confidence in how you can add on to your healthcare team at whatever site you're on. So for me, it was also being able to add credibility to what I do, but also give assurance to those that I'm collaborating with.
Awesome. So let's back up a little bit to pre-pharmacy school. So we have a question here. Student is currently a full-time undergrad student. Do you recommend to get a specific experience before getting into pharmacy school? What are your experiences in pharmacy school? Any expectations?
I
For
think
me,
that, oh, sorry.
but go ahead, Danielle.
I was just gonna say I volunteered in a pharmacy before I went to pharmacy school to test it out, I guess, to see if I liked it, and that helped me identify that I did enjoy the field. So that if you have the time available, I know time is precious. I would say that would be a good experience to see if it's something that you like, shadowing a pharmacist or volunteering in a pharmacy to test it out.
Yeah, I would agree with that. I shadowed as well, and I used my rotational year to pick practice settings I thought I might want to work in to get a little bit of a peek into what it was like in each of those practice settings. I think that's a really good thing to do and a good way to use your appy year instead of, picking things that might be easy to get through or convenient location wise to just really pick some things if you don't know exactly where you want to go to practice. I think that's valuable. Um, some people do certain internships. I just did community pharmacy, so I didn't get too much into that, but that's also an option if you know what route you want to go and it's a very specific one, like industry or hospital. You can always get volunteer experience there.
I would agree with that. I would say the biggest expectation is don't have any expectations. When I first started, I was like, I am going to work in the ICU. I had shadowed and volunteered at a hospital, and I was like, this is exactly what I want. And then by and large, you like get into it during school, and I was like, oh no, I don't want to do that after all. That's not for me. I like talking too much. So clearly that was not going to work out for ICU patients where a lot of them are intubated. But then I interned at a compounding pharmacy, and I was like, oh, I'm going to do compounding. I really love this internship that I've had while I've been in pharmacy school. And then you get out of rotations, and there's so many very different experiences that you maybe haven't had before. And then really it was like halfway through my appy year where I was like, oh, I fell in love with clinic. And that's when I decided that I was going to do residency and go the clinic path. So I think the biggest thing is just don't have expectations when you get into it. Be willing to try everything and put a lot of different things on your list. So before you get into school, volunteer different places if you can. If you have the time, being able to try something inpatient, then go shadow outpatient. See if you can get in at a clinic. Most of the time, health systems are more than willing to have volunteers come in, and they really appreciate the extra set of hands. And so being able to make those connections locally and kind of just explore a little bit is, I think, the best thing that you can do for yourself.
Awesome. Which is more beneficial for becoming a clinical pharmacist, completing a residency program or obtaining the board certification? And which one helps more in building a clinical career?
One thing I will say from like a hiring perspective, because we have quite a few clinics on board, is I don't think that you can particularly weight like one thing more than the other. I think it's about like the person as a package. And so, yes, doing a residency shows that you've gone through like very intensive training and you have a background in that clinical experience. But board certification also can show similarly, oh, you are very well versed in this particular topic area. So I don't think it's necessarily like pick one or the other. It's more like, what type of experiences this has and how has this person showed me that they have the breadth of knowledge that I would expect in this clinic role. So I think that that's more what it's about versus like ticking one box versus the other.
Yeah, I think they both have merit for sure. Just in being someone who's hired pharmacists for 7 years, I would, yeah, I would look at the person, I would weigh them equally. It is nice to have the credentials that come along with the certification, and that is kind of nice, especially from an academic detailing pharmacist if they're doing presentations, because the rotation or the residency is awesome and it's part of your background and it's on your resume, but it's not necessarily something that's forward facing as much as the board certification. Not that one would outweigh the other.
Great. Thank you. Next question, and I know Kate, I hate to put you on the spot again, and I know you answer it in the chat, but I think this is a great question. So for pharmacy students, is there an IPE or APPE rotations offered with BPS?
So while we don't offer an IPPE, we do have an APPE or APPE rotation that will open at the end of the year. So we typically do our recruiting end of year, so Q4 of 2026. Be on the lookout for that. We'll post about it on our socials. There's not only that APPE rotation, but you'll also have the postgraduate training. So even if that's not in your next 1, 2, 3 year plan, it is something that you can kind of bookmark in what you'd like to do postgraduate.
Perfect. Thank you. Okay. I'm going to jump back to some pre-submitted questions here. So this one asks, is board certification necessary or required in order to work in a hospital?
I guess I can hop on that one. So it kind of depends on the institution. Every institution is going to set their own policies in terms of what they require for getting your foot in the door. What I will say is like locally, we traditionally have not like seen that as like a requirement. It is nice to have because much like Angela said, the kind of like forward-facing letters of board certification, they kind of like speak to what your experience level is. But it's not something that's like a hard stop, like, oh, I'll never step foot door in a hospital if I don't get this.
And I'm glad Jennifer commented because I'm an outpatient pharmacist. So I'm like, this is hospital, but it functions the same way essentially for different practice settings where being board certified definitely, like as we said before, is very face fronting, or I forget the actual term, where it allows others to immediately know some type of credibility. But yes, it will depend also on region of how prestigious again institutions are around you, where it's like, how do we find and how do we filter out the most qualified, even though all of us should be qualified. And so usually in those more, again, those types of cities, that's where, again, those will be more of the maybe make it or break it as far as decisions. But generally in most places in more common hospital practice settings, again, as long as you're able to show your CV that you have credible experience and maybe you have the, again, credentialing, I think that'll be wonderful. But from what I've seen, at least locally at most places, again, it's a wonderful thing to have, but it's not always a hard requirement.
I would agree. Although the board certification isn't a requirement to work at a military hospital, if I were to see that on a resume, I would be more inclined to place that person in a supervisory position of an inpatient pharmacy versus just a staff position. And it definitely it shows that they're the subject matter expert in that field. So not a requirement, but definitely a resume booster for sure, and could open the door for more supervisory positions.
Great. Thank you. Another chat question. So for someone who has been a pharmacist for 20 years and wants to move to a medical liaison role, how important do you think it is to obtain or helpful to obtain a board certification to increase your chance on getting a role in that field? I know it's a very specific question if anyone has any insight.
I do as a faculty, if anyone doesn't want to go first. So within my role as faculty, part of it is also giving advice to our students who are pursuing various avenues like fellowships, residencies, or going right into practice. One of the biggest things that I will say is connections. For the fellowships, it's all about your connections. It's not too much, unfortunately, to do with your certifications, but more so who do you know and who potentially gives you an in. So for that, I would highly recommend looking at LinkedIn and then again, trying to find all of these MSLs in the areas that you're interested in and then reaching out to them. Because again, it's more literally within the job role of an MSL is to form these connections within a bigger ecosystem. And so most of the time it's going to be who you know. So that's for me something that I think like I tell students, I'm like, yes.
Yeah, super helpful. Thank you. This question is in the chat, and we also got it pre-submitted too, is do you have to do a residency to get your board certification? I know some of you have touched on this previously, but if I could get one to kind of talk about this one again. So do you have to do a residency to get a board certification?
You do not. I've not done a residency.
Yeah, we have people qualified through both residency programs, but also through the practice-based experience. So I think the main thing is like you just have to make sure that you're meeting the requirements for that individual certification, but there are multiple pathways for each.
Let's jump back to some of our pre-submitted questions. Going back to the general path to pharmacy school, I feel like we get this question a lot, but do you need to enjoy organic chemistry in order to become a pharmacist?
That's a great question. I don't know that anyone enjoys organic chemistry unless you're a bit of a masochist, but it's definitely a very important part of pharmacy school. I thought it was the most challenging class in pharmacy school, but you lean into it and you get through it. You don't have to enjoy it, but it's a very important part of pharmacy school, and you will experience it.
Yeah, just to echo that, I think it's the same like organic chemistry or a lot of calculations, things like that. You don't necessarily like have to enjoy every part of it, but you do have to work hard at it and you have to achieve a certain level of competency in order to practice where you need to be. So that's kind of like the catch-22 is like I don't know how much enjoyment there is in it, but you do have to be like at least decent at it in order to get where you're going.
And I want to give some OrgoChem some love because I did like OChem. So maybe I'm a masochist, I don't know. But I definitely did not like all of the prereqs for pharmacy school, which if you look, to the PAs or the nursing or even physician or medical school, it tends to be very similar because you're not supposed to be an expert and be like, I love all of these prereqs. It's more so kind of how Jennifer said, did you manage to at least show us that you were able to do it? Because this is the foundation for other topics that won't borrow 100% from this, but there will be, again, a lot of concepts that will come back up. So it's kind of, you don't have to be a master, but you can at least remember, not necessarily a C, at least a B is what I say. I'm like, and then most schools of pharmacy will be like, yep, they're pretty much average in terms of not everyone likes OChem, so that's good enough.
And another chat question came in on chemistry. So, what were some common topics of organic chemistry, and what strategies did you use to get through organic chemistry?
It has been a long time, but guys, I'm still very much haunted by chirality. So they have those like little like stick and ball models that you can do with the molecules, and that really helped me at least. I'm not like a good like 3D visualizer. So that's one of the things that my professor actually recommended. They were like, they make these models online that you can like help visualize things, and that really helped me when we got to like that section. That was something that I struggled with.
And just going off a little bit off Jennifer's response, it's really the visualness that I think makes it very difficult for everyone. And so if models are not your thing like it is for me, I like to draw. And so for me, and I remember retrosynthesis where they give you, this is the final product, how did you get that? And so you kind of have to go backwards in time and be like, and I think of Markonikov and all of the other things where I'm like, I actually did like it, but unfortunately my real life career has nothing to do with OChem. So for those that really don't like it, it won't play out in the real world for most of us. Actually, I'm surprised that for Danielle, I'm like, as a serial compounding, I was like, I don't know, it seems like it would actually kind of be more within your domain. But yes, it's
It does enter a little bit. It's the class itself was something that I tried to black out from my memory. But I agree with everything that's been said. I am also a very visual learner. I think it helps to try to do some introspection and figure out what type of learner you are. And if you are visual, then all those things that have already been mentioned can greatly help for sure, which I am as well. So yeah, can't say that I enjoyed it, but there is applicability.
Awesome. Another question here, not organic chemistry related. We're moving on from that. But for those who are pre-pharmacy, would you liken the board certification exam to college entrance exams like the ACT or the SAT? Or if not that, what is it kind of similar to?
I personally would not. And I think that's just because like ACT, SAT was so broad. It's like here is like a general capability test. When you get to board certification, it's like here's a very disease state or a very like specific situational question. How are you going to treat this patient? And so I think that the like depth of knowledge you have to have for board certification is much more extensive than what you're used to on those type of exams. Now, in regards to like formats, how like questions are structured, multiple choice, things like that tends to be more similar, but it is not going to be like, oh, I can guess from context clues, like which one I'm going to guess on the ACT versus for the board exams, it's like you have to really know your stuff when it comes to like the clinical situation and how to interpret these labs and how to adjust these doses and that type of thing.
Yeah, I agree with that, that guessing will not be on your side. It really is like you can't just pull it out of memory. You have to understand it. That's I think the difference for me is that like ACT and SAT, you could kind of memorize things with board cert. It's going to suss out if you really understand what you've learned. And it'll give you situational questions. They won't all be situational questions, but there's going to be some of that in there. And the CEs actually also are kind of formatted like that. So you'll see that as a recurring topic that it really makes you have understood the material that you've taken in.
Great. If someone doesn't have much hospital experience, does board certification help fill the knowledge gap, or is experience more important?
I don't think I would look at it as like board certification, like filling a gap. Board certification typically just like is showing what you know. Like it's a clear, visible way of showing what you know. And so like if you have no hospital experience whatsoever, and you're trying and you know like sterile compounding experience for whatsoever, you're not going to qualify to like take the exam anyways. Boards is more about like let's look back at your experience or look at your residency, and then this is an opportunity for you to public facing show us what you know. So it's not necessarily going to bridge a gap if you have an existing gap in your resume.
And just because I love Jennifer's response, I would say another word to add is just the validation of the experience of it all. So kind of like if there's, again, we're not assuming that there's a gap. If anything, it's the fact that I belong here because of my experience, and this is then validated by this credential. Versus, again, you would need the hospital experience to first even be able to sit for the exam, or quantity if you didn't do it through the residency route, which you can get certification through the residency route after you. For most cases, after you do for a 1 year, the BC or the BPS or BCPS one, and the subspecialty ones after usually the second year. But again, we've talked about alternative careers or alternative routes to get to the same way, which again, if you were to do hospital without a residency, then you would need to be at that hospital for a certain amount of time, which then requires your manager to vouch for you and say, yep, so and so has been here for so many times or so many years. They are able to take this test because I can vouch for that experience. So kind of going back, and it's like that's not about the gap, but it's more so to validate that time period that you were there.
Great. Thank you. So a lot of you or all the panelists have talked a little bit about what specific specialty you are all certified in, and this might be more of a question for Kate, but I'll open it up. But what specialties are there in pharmacy, and how long do they usually take to earn? Is the field growing in demand?
I can take this one because I feel like it's much more about the organization. And one of the things that BPS loves to say is that we are a reflection of pharmacy, not the person leading it. So while we currently have 16 certification programs, we're currently looking at other ones, such as veterinary pharmacy and pharmacogenomics. While we did issue a moratorium just because we've had a lot of change recently in terms of adding new specialties like pain management, emergency medicine pharmacy, pharmacy informatics. So we want to make sure that what we're doing is working and making sure that existing programs are also given some love, like nutrition support, nuclear pharmacy. So I think there is a lot of growth in pharmacy. Board certification itself has skyrocketed since the early 2000s. So there's a lot of demand, not only in the US and internationally, but we want to make sure that we're not, putting out brand new specialties each and every year if there's not a demand. So would definitely recommend that if you're interested in a specialty, take a look at the website. There's 16. I can't name them all for you right now. And there's even more that could potentially be coming down the way. So definitely stay tuned.
Awesome. And I'll send a follow-up email probably tomorrow, and I'll share the BPS website and our Pharmacies Right For Me website as well, so you all can explore the diverse career field of pharmacy a bit more. But to our next question here, is there a practice exam or where could learners find sample questions that are BPS like to give a flavor of the specificity?
I think, as it was maybe mentioned a little bit earlier, is a lot of like the CEs will have questions that are typically written in the type of flavor of this is what you would see on an exam. And then also a lot of the study materials do include like sample questions. So regardless of where you get those materials from, they usually have questions to kind of help support like this is what you're going to experience. So at least when I was studying, I had like a booklet of like older CEs. And so we use those questions to kind of get familiar with format.
Great. Oh, Danielle, did you want to respond? I saw you on mute.
Yeah, it's specific to sterile compounding, if that's the one you're interested in, but I used ASHP's sterile compounding pharmacist course, and at the end of the course there was a practice exam that I thought was very comparable to the board exam. And then it wasn't a very thrilling read, but I read through USP 797 and USP 800, and that really had a lot of the information that I needed for the exam as well. So again, not a thrilling read, but it had all of the information I needed. And then I thought that course, the practice exam at the end, was very comparable.
Great. I feel like we get this question in a lot of panels that we do. With the impending expansion of AI, do you see any way pharmacy could be negatively impacted?
I can answer that one because I love technology. I think I mentioned earlier that in my clinic, I try to have all of my patients with diabetes on sensors and when possible on a Omnipod just to make things easy. And so going back to the AI, I do believe that this is why having this conversation is so important about being specialized and having this expert knowledge to be able to really not only just give the right answer, but then to also communicate it to a real life person and to a real meaning patient, but also healthcare providers who they can Google this, they can open evidence this, they can do all of these things that we also have access to. But the very big thing that this is where AI will never replace us is the fact that we have the face, we have the soul to then kind of like Danielle, which I'm already impressed just because I'm like, you read USP like for 700 or whatever it is, because I'm like, that was so dry. And you got
Maybe I'm a
credentials. And
masochist too. Maybe we're two of the same.
but nonetheless, like you can again essentially control find whatever the solution is, but again, that will never replace someone like Danielle, who again has again a personality, is able to then problem solve and again have that human connection that again AI will never, well, who knows, right? Knock on wood. But until again they're able to have someone in front of that person who lacks health literacy or again prefers that contact, even telephones sometimes don't work with some people. I'm like, it's really hard to do certain things with just automated, I guess, like artificial intelligence and learning machines is what I've discovered.
Awesome. Thank you. Jennifer, did you want to add anything?
Yeah, and what I will say is like we do use AI in some of the clinics. Honestly, we use it a lot for like summaries of like this is what happened since you've last seen your patient 6 months ago. Or we'll use it to like fill out paperwork that they need for particular insurance forms. So we use it for more of the individual like items that you may see that may be a little bit more administrative. But I think the place where we really shine is where it's coming to like the clinical work, because yes, like you can have a guideline, and if you say like, what should I do with this diabetes patient and their insulin regimen? Yeah, AI can probably spit out based on the guideline, this is what you should do. But then you're like, oh, this patient is maybe afraid of injections, or they've had a bad experience with this particular pen device because they have arthritis. There's so many patient-specific factors when it comes to practicing pharmacy, practicing medicine, practicing nursing, just healthcare in general, that I think that while we can use AI as a tool to really like optimize our patient care and what we're doing, it will be a very long time, if ever, where you can get to that level of detail and provide the same level of care that a patient is happy about and that they feel well taken care of, and that they also have had all of their needs and desires taken into account in addition to those basic guidelines.
Great. Thank you. Shifting gears a little bit, one of the pre-submitted questions asked, how do you practice internationally with your BPS certification? Or is that possible?
Although I've worked in pharmacies in Germany and Kuwait and a few different places of the world, I was always in a military hospital. So I don't know if that's technically considered practicing internationally. I will say the board certification helped me prove that I was the best person to send to that hospital, because they were building a new inpatient pharmacy there and they needed to figure out all the engineering and types of things that you would need to do in that country. So I was chosen to go to that place, but I don't think I can count that as practicing internationally, since technically I was still in a American military hospital. I'm sorry if that doesn't help.
No, I think that's great. Awesome. Jumping back to a chat question. What are specific roadblocks during pharmacy school and the pharmacy jobs that would be good to be aware of?
I
I
think
think one thing, go ahead.
I was just going to say, I think one cool thing is, I didn't realize this when I went to pharmacy school, but there are so many different types of pharmacy jobs. There's so many things you can do in the field of pharmacy. I can't list all of them, but I did find it really cool, honestly, that just about anything you're thinking, there's probably some way for a pharmacist to work in there, whether it's like the clinical setting or more policy writing or administrative. Or I have a friend over that at the FDA that reviews like the drug commercials and stuff, so that feels like more marketing. You can really do so much with pharmacy. So then at that point it becomes, what are you interested in? What do you like to do? And you can find a job that fits that.
Amen to sorry.
No, you're good.
Who's next? Okay. Are you sure you can go?
No, I was just gonna say I agree, and finding the job that you want and the practice setting you want can be hard too. But I found it helpful to get involved in organizations, even local ones too. So I got my job at Rational Drug because I went to a Christmas party at the Ohio Marshall County, and it was a county, like the two counties. It wasn't even a national one. Pharmacists Association meeting, and I ran into someone who recommended the job. So, because I would have never thought to look on a school website if I wasn't thinking about teaching, which at that time I wasn't, for a managed care job. So, to find job, networking can be your best friend.
And then just to add to everyone's responses, I think specialization at the end of your pharmacy career will be something that's very important to consider, because one thing that I notice is that within the traditional community pharmacy setting, because of automation, because of AI, those roles again will start to be negatively impacted, to where again, we hear all these really cool things that a pharmacist could do. And so the more you're able to speak on your interests and then potentially find some type of relevant pharmacy avenue, you're going to have a very fulfilling time. Versus, I think now, again, just entering the curriculum and being like, I'm going to be just whatever type of pharmacist they produce me to be, maybe again, I think the biggest roadblock in terms of not necessarily you need to know what you're going to do, but more so knowing that specialization is going to help a lot to have to I think to have to be able to contribute to whatever healthcare system you enter, versus just again graduating and being like, oh, I'm going to be a dispensing pharmacist, which nothing wrong, but there's more to be, I think, had if you have more of that mindset of let me find something that again I can marry into this profession.
I think in terms of roadblocks, one thing that is like really common amongst like pharmacy school, and also then when you get into like later job searches, there are also going to be things specific to you that aren't necessarily pharmacy specific that may be a roadblock. So like during pharmacy school, I feel like everybody's like, I don't have enough time. I don't have enough time. And so being able to like set up your time for like making sure you're doing enough career exploration, making sure you're giving enough time to your studies, like that is something you have to be very intentional about while you're in pharmacy school, because it does ask so much of you. And I think that that is also a potential roadblock when you get out and start looking for jobs, because if you haven't been intentional and you haven't blocked off enough time to really dedicate yourself to that while you're in school, or even when you're in pre-pharmacy and you're seeing, am I going to go to pharmacy school? If you haven't done that up front, then when you get to the job search, you're going to be like, what do I apply for? And that can be a really daunting question if you haven't done that exploration. So I think the main thing is just making sure that, yes, you're open to opportunities, but you also are being very intentional about what time you have and what next steps are in school, in your career, or kind of just in developing your path, because you are only as prepared as you set yourself up to be.
Great. And the next question actually goes really well with that. Are there any resources that I can find more about the variety of pharmacy careers with different settings? And I would just plug some of our resources, and I'll put some websites here and some links in the chat. So I shared two. One is our Faces of Pharmacy page that details the journeys and stories of a ton of different pharmacists and the different roles that they work in and how they got there. And then the next one is the Careers in Pharmacy page that just details a fraction of some of the careers that are out there that you can learn more about. And some of them will actually link you back to the BPS webpage if there's specific certifications that go along with it. But there are definitely some careers out there that currently don't have a certification yet, perhaps, but that you can still explore. So I would highly recommend that you all check out those websites there. With the last 2 minutes that we have, I always like to end.
I don't think so.
Oops. Like to end on this question, which is what advice would you give to prospective students looking into pharmacy or current students looking into board certification? However you want to answer that question.
I would say try all the different types of pharmacy, see what is most fulfilling to you, what you have an interest in. Now you know that there's so many different flavors of pharmacy, and you can really find something that kind of connects with you and brings you a sense of purpose, or at least something that you're interested in. And then from there, you're going to have a great career.
Yeah, I think I would say the biggest thing is it's okay to change your mind. What I thought I was going to be doing in pharmacy when I first started, and the reason I went to pharmacy school even, are vastly different than like what ended up happening in my life. And that's okay. But as long as you are willing to continue trying new things and you're willing to say, okay, I've tried that, it's maybe not for me, like what do I do next? That is the best way for you to figure out like what is something that I can do for a long-term career, because there's nothing worse than like being like, oh, I have to do this, and then you feel stuck. Like it's okay to change your mind and pivot if you need to.
I would agree with that and echo that. I would have never thought I would have been in managed care, let alone management.
And not that I really had my mind set on retail, but yeah, it's nice to keep an open mind, keep networking, keep exploring new opportunities, and just do what you like. Yeah, just always make sure you're studying something that you like. I know for my path, a lot of people in my position recommended getting like my MBA, and it just sounded so boring to me. So I just kind of taught myself that aspect of it and went the BCPS route because I just would rather study clinical stuff than business stuff at night. So just go with what you like and it'll land you where you need to be.
And backing off, well, or jumping off of Angela's response, I actually wanted to become a community pharmacist when I first started my journey. And so I'm very much removed from that initial dream. And so I think the biggest things that I would say to students entering pharmacy school is to seek mentorships early on, find different types of pharmacists to just ask advice for, community pharmacists, hospital pharmacists, to again continue this type of conversation. And again, just like we've all been saying, stay open because I wanted to be at CVS right now in Chicago and I'm in El Paso, Texas, right? So it's kind of really cool how this profession can take you to different spaces and just saying yes to opportunities, even if they feel slightly outside your comfort zone. Because again, I'm hearing a lot of the pieces of wisdom that I heard. I'm like, yes, I agree. I completely resonate with those because some of these experiences, again, that were just I was like, me being in this leadership role, like I don't see it. I just want to, again, as we say, flip or is it swing the pills to pay the bills, or is that how we say? I don't know. That's what my students say, meaning that pharmacy has evolved, and it's really cool to be able to jump into different spaces of it. And so, just being open and remembering that it's ultimately about people.
Awesome. And I think with that, I hope the audience will join me in thanking our panelists for such a great panel. Thank you so much for sharing your insights with us. And also thank you to Kate McKenna for talking a little bit more about BPS. There will be a quick survey that will pop up right after this. So please take that to let us know how we did. And I will send out a quick follow-up tomorrow with the resources that were shared during today's session, as well as the recording. And if you ever have any other questions related to pharmacy, please feel free to reach out to us at aacp.org. And with that, I wish you all a good rest of your evening, and I hope to see you at our next event. Thank you all so much.